Welcome back to the show. Our next guest is Zachary Hall, Doctor of Physical Therapy and Regional Director of South Sound Physical and Hand Therapy in Lacey. And he's speaking about the benefits of physical therapy and his role as a physical therapist. Here's Shannon with Zachary.
Zach, thanks for joining us on Health Talk. How are you?
I'm good. Thanks for having me, Shannon. It's an awesome opportunity for us at South Sound.
Yeah. Listen, we're going to talk about a lot of stuff today, Zach. But like Tom said, you're our regional clinic director. You've been with IRG, South Sound Physical Therapy. These are two businesses underneath the IRG kind of brand. So, you manage about 5 or 7 of our clinics. I don't know. I'm confused most of the time. But anyway, you're managing a lot of our clinics in the South End. But tell our listeners, I'm always intrigued, particularly in the physical therapy world or healthcare world. Usually someone gets interested in the field of their choice. Sometimes it's an injury. Sometimes it's someone in their family that received care. And it's like, oh, that looks pretty cool to me. I want to pursue that. How'd you get interested in the profession of physical therapy?
Yeah, so kind of the same deal as most of the therapists, it sounds like. I was, playing baseball in high school and ended up injuring my shoulder and had to go to physical therapy. And never really been before, but they were able to get me back on the field without any time lost. And actually, my shoulder felt stronger than it had in years. So kind of showed me the value of physical therapy and what it can do for you as an athlete. And that kind of led into my interest. I always had an interest in the medical field and wanted to do something that integrated both physical activity and medicine. So, that's the physical therapy is the kind of area where those two met for me. So.
Yeah, absolutely. Physical therapy as a profession, I think you and I both would agree. Sometimes I think physical therapy has a little bit of what I call an identity crisis. I'm not sure the general public really understands the training, the intervention, the specialties, the skill set, the outcomes, the research that's behind our physical therapy profession. All physical therapists, by the way, right now are coming out with DPTs. Tell us about your education, Zach.
Yeah, so, I graduated 2012 from A.T. Still University down in Phoenix, Arizona area, and you graduate with the Doctor of Physical Therapy now. So we're kind of your movement specialists. I think the identity crisis you're talking about, you have a dentist that works on your teeth, you have an optometrist that focuses on your eyes, you have all sorts of specialists. So we're that kind of movement orthopedic specialty position in the medical field where we're working with your musculoskeletal, nervous system, cardiovascular, integrating that all together so you have a better, movement pattern. You're moving through life without pain.
I love how you say movement specialist. Movement kinesiology. Body mechanics, muscle physiology. We look at all the systems in physical therapy. We're trained to look at all the systems. You talked about, the nervous system, which is so important. But then you take all that information that you learn. You're a DPT, a doctor of physical therapy. For our listeners, that means Zach went to 4 years of undergrad and then was accepted into grad school, which is a 3-year program to become and be trained professionally as a physical therapist. During that 3 years of education, Zach was learning everything there is to know about the body, movement, therapeutic interventions. So highly skilled and well-trained young therapist or just therapist coming out of school. Zach, tell us about your daily activities as the regional clinic director down at our family of clinics in South Sound.
Yeah. So we kind of span there. We have clinics in Frederickson, Bonnie Lake, Tacoma, and then a bunch of clinics down in the Olympia, Lacey, Tumwater area. And at our clinics there, we kind of we have a ton of different specialties. We have manual therapy, sports rehabilitation, balance and falls prevention, cardiovascular, which is big, in these kind of COVID times that we're living in, getting people back from that illness. Pelvic floor, aquatic therapy, TMJ. We treat vertigo too, which a lot of people don't think we treat vertigo. And then we have an amazing industrial rehab clinic and an amazing bunch of hand therapists too that help you get back with those fine motor type of injuries from the hand and elbow. So yeah, my day to day is just kind of help mentor and help the physical therapists with their jobs so they're better able to help the clients around. I also still see patients down here as well, so I'm still integrated within the community and within the healthcare field, and love treating people and getting back to what they like to do. So it's a great kind of blend of both for me, and I love being in this area, this community. I grew up in it, so it's a nice return to the community.
More with Dr. Zachary Hall right after this time out on Como News 1000 FM 97.7.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
The conversation continues with Shannon O'Kelly and Zachary Hall, Doctor of Physical Therapy and Regional Director of South Sound Physical and Hand Therapy in Lacey.
Zach Hall, again, thank you for joining us in Health Talk, and thank you so much for being part of the South Sound family and the IRG family for that matter. You do a great job for us. You're an excellent provider. You're a great motivator. You're a great leader, and we're just so fortunate to have you down there. I'm interested, and I want to kind of hit this home a little bit. Again, we talk about physical therapy, having somewhat of an identity crisis. You mentioned all these services that you can get in physical therapy. I don't know that, again, the general public understands lymphedema, temporomandibular joint problems, TMJ, hand therapy, the fall balance vestibular. All they got to do is reach out and connect with you, and you can explain to them what service, because we can take care of almost everything from A to Z when it comes to the human body, so to speak, when it's rehab, movement, and function, right?
Oh, yeah, definitely. And I think we have a great, reach in physical therapy. We can go to more than just the orthopedics. We also, I'm excited to say we're going to start a acquired brain injury service down in the South Sound area too. That's working with people with concussions, traumatic brain injuries, post-stroke, and to get them back their cognitive function. It's kind of a new field of physical therapy that's really exciting and a good opportunity to get people back from those types of debilitating injuries as well.
Again, I think you and I would both agree, the neat thing about physical therapy is I think we can kind of intervene in a lot of different areas, and most physical therapists, or a lot of physical therapists, like to specialize. You talked about ABI Wellness, Acquired Brain Injury Wellness. This is a platform that we're going to start using here at IRG South Sound Physical Therapy to kind of help those people that maybe had concussions, TBI, a traumatic brain injury, or maybe even sometimes we talk about long haulers with COVID, having some brain fog. But we're going to have this platform that's going to facilitate, neuroplasticity, and that's a big word in the neuro rehab area. So I'm pretty excited about that too, and I'm excited to get out there and help those people that have those conditions. Zach, what excites Zach Hall? What excites you about being a physical therapist?
I think what excites me the most is that I don't like to approach the patient. Patient with the same injury, they come in and they have a diagnostic code, and they can say, shoulder impingement, but I don't like to approach it with the same kind of eye on every person. I think every person's an individual, and I like figuring out that puzzle with them, how to return them back to their functional goals, whether it's, sport or just getting back to their regular kind of activities of daily living. So what excites me about it is it's such a, there's no one right answer. I kind of get to use my brain and work with the patient to get them back and, tailor a plan that's specific to their impairments and their needs versus just kind of like I don't believe in the cookie cutter type of treatment where you just get the same exercises no matter what injury. So I like that puzzle that each patient presents, and then working with the community down here to get people back to what they like to do.
I love that description you just provided. It is always interesting. Every patient, every condition is different. I think the joy of being a physical therapist for any physical therapist is the relationships we build. It's so important that we talk about the soft skills, the listening, the empathy, the relationship building with our patients. Zach, thanks for everything you do, and thanks for joining us Health Talk, okay?
All right. Thanks a lot, Shannon.
Thanks to Zachary Hall, Doctor of Physical Therapy and Regional Director of South Sound Physical and Hand Therapy in Lacey, Shannon, and he is a busy guy.
Yeah, Zach is. We're fortunate to have someone like Zach Hall being a regional director for our physical and hand therapy services in the South End. And so excited to have Zach talk about kind of physical therapy services and what physical therapy is in today's world, the education, the training, services. These are very special clinicians that can provide very special care.